Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we are going to learn an important cardiovascular surgery topic, which is coronary artery bypass grafting, also called CABG or CABG. So first let's understand what is CABG. So coronary artery bypass grafting is a surgical procedure performed to restore the proper blood flow to the heart muscle, and by bypassing the blocked or narrowed coronary arteries using vein graft or arterial graft, sometime combined grafting. Okay, so we will see very simple and effective way to understand the CABG CPT coding. Okay, so let's see the code set. So you can see whenever you are coding a CABG procedure or when you are preparing for CPC exam, you always feel this cardiovascular subject is difficult because it takes a lot of anatomy portion as well. So if we are not strong in anatomy, then definitely we feel it is little complicated. Okay, so let's understand in a different way to figure it out, like how exactly we can code or navigate the question that if they ask related to CABG procedures. So first, all you have to do is identify uh, what kind of grafting they are performing. Okay, are they performing vein graft or artery graft or artery plus vein graft? Okay, which is combined grafting. And then you also need to check number of grafts, how many grafts they have utilized in order to perform the grafting. You have to check. Lastly, you need to check harvesting or a surgical method. Okay, so first let's see the code set. So you can check the vein graft. Vein graft code ranges between 33510 to 33516. Okay, this is the vein graft CPT code range. And then if you check the code description, CPT code description, each code contains number of graft being utilized. Okay, 33510 single vein graft, 33511 two venous graft, 512 3 venous graft, 513 4 venous graft, 514 5 venous graft, and 5166 are more venous graft. Okay, so this chart will be very helpful if you keep it when you are studying. Okay, if you keep it as a reference, definitely you will learn quickly. So next comes to artery graft. Say for example, they are performing CABG utilizing artery. So then your code CPT code ranges between 33533 to 33536. Okay, so you can same check the artery graft code according to the number of grafts. 33533 single arterial graft, 534 two arterial graft, 535 3 arterial graft, 536 4 or more arterial graft. Okay, so next comes to another important thing, which is combined grafting, where the provider will be utilizing both artery and vein graft. Okay, so in this case you have to remember one coding guideline, that whenever you are dealing with the combined grafting, you must utilize arterial graft as a primary codes. Okay, so arterial graft we will code primary, and followed by artery you need to take venous graft add-on code. Okay, we have a separate vein graft codes which are add-on codes. These codes will be used only with the arterial grafting, which is combined grafting. Okay, so when they are performing both grafting, you have to take arterial graft primary codes, and to report vein grafting you must take the add-on codes. Okay, this is a important guideline, so always remember artery followed by vein graft. And if you check into the other thing, uh, single vein graft, here in this vein graft coding, we have primary codes. This vein graft code will be used only when the provider is utilizing vein graft alone. Okay, when it is a single procedure related to vein, we will take the primary code and we will assign the vein grafts. But when it comes to artery plus vein graft, then you will code the artery primary graft, then you will take vein graft add-on codes. Okay, say for example, if a provider is using two arterial graft and two vein graft, I will code 33534 for two arterial graft, and to report the two venous graft I must take our add-on code 33518, okay, which says 2 venous grafts. So it is very important. So you should not go back and select the code from vein graft when you are dealing with the combined grafting. So next we need to check the important guidelines for harvesting. Okay, from where they are harvesting, that we need to check. So what is harvesting? So here you can check, they can harvest either from vein or artery. So when it comes to vein, harvesting of saphenous vein is included in the vein procedure. Other vein like other upper extremity veins require separate coding. Okay, so whenever they are taking vein from the saphenous vein, you don't need to code harvesting code separately for saphenous. Okay, when they harvest vein from other than saphenous graft, okay, from extremities like upper extremities, saphenous will be belongs to lower extremity, and the rest whatever the vein that we have from upper extremity, if they are harvesting from those region, you can code them separately. Okay, and same way coming to arteries, here harvesting of all arteries are included in arterial procedure except upper extremities. Okay, upper extremity arteries like radial or ulnar. So from these two arteries, if they harvest, you need to code separately. Rest you don't need to code separately. Okay, those are will be included in the procedure. So check the codes now. If they harvest from uh, you know open vein, so you will code 35500, and then endoscopic procedure 33508, and then femoral 35572, and coming to upper extremity artery code 35600. So these are the harvesting codes. So first you will identify how many graft being done or what is the type of grafting they are performing. Then you will first figure out your CABG codes. Okay, then you will come to your harvesting CPT codes, and with respect to from where they are harvesting, you can able to get the codes. Okay, so now let's see one clear example to understand this concept in a simple and better way. Okay, so you can see the CPC exam case study question. So patient with the atherosclerotic heart disease add a 3 venous 2 arterial grafting using saphenous vein and femoral vein and radial artery. Okay, harvested by surgeon performing the graft. The venous grafts were procured using endoscopic harvesting technique. So it's a very simple and direct. Okay, totally they are utilizing 3 venous and 2 arterial graft, so which means it's a combined grafting. Okay, so together you have 5 grafts here, 3 plus 2, totally 5 grafts are there, but it's a combined grafting. So as I already said, when they are doing combined grafting, you must take your code from this region. Okay, so you can check here for artery, as I already said, you will take the primary codes for artery, but when you are coding for vein graft, you must take the add-on codes. Okay, and then you need to look into the harvesting, and they have mentioned they have took from saphenous vein. So saphenous vein will be included, and you should not code for the harvesting, but femoral and then radial artery you need to code separately. Also endoscopic. Okay, all three you should code separately. So now if you look into option A and B, C, D, so closely you can check, and you can also take 1 or 2 minutes since I've added chart here. You can have a glance and you can only able to give your answer. Okay, so you can take 1 or 2 minutes and figure out what is the right answer. So when it comes to a correct answer, so if you can see here, if you check the option B, 33534. Okay, so firstly, as I already said, 5 grafts are there. In that 2 are arterial graft, and the 2 arterial graft should be coded from here, 33534. Okay, so this is our first code. Then looking into your 3 vein graft, that should be coded from the add-on code, which is 33519. Okay, so now you are done with the CABG codes. Next, you need to look into from where they are harvesting. So already I told you saphenous vein you can ignore. Then comes to femoral popliteal vein. So then here if you check femoral vein code 35572. Okay, and the radial artery code, okay, which is radial artery code, upper extremity code 35600. Okay, then they have also utilized endoscopic harvesting technique 33508. Okay, simple. So first you got the CABG code, then you got the harvesting codes. So option B is correct for this question. Okay, simple. CABG will be very simple if we understand in this way. Okay, so if you keep the chart as a reference, or if you can see, or if you can highlight something, some keywords in your book, okay, this is how you can navigate. And yes, that's all for today. I just wanted to give you a quick knowledge, like, so I did not went and discuss all the anatomy portion. What is needed for your CPC exam or to understand the CPT concept, I have discussed here. Okay, so know the guidelines, and just once you understand the basic about the concept, the next thing you need to identify, is there any coding guidelines are there. If guidelines are available, you should know, you must apply the guideline in a right way. Okay, so that's all. These are the code set, and this is how you can make CABG coding as simple as that. Okay, so thank you all, thank you for watching, and I'll try to upload this kind of videos in a simple and effective way. So please do watch all my videos and support. Okay, thank you all, bye bye.